Liver. 1. Largest gland. 2. Flat sphere-shaped functions. 1. Metabolism of proteins, lipids, carbohydrates, and vitamins. 2. Defense and detoxification functions. 3. Bile production. Surfaces. 1. Facies diaphragmatica right pointing arrow upward and front. 2. Facies visceralis right pointing arrow downward and back liver boundaries and margins. 1. Superior margin. R10 right pointing arrow R4, highest, right pointing arrow R5 right pointing arrow right intercostal space. 2. Inferior margin. R10 right pointing arrow R8, R9 right pointing arrow R6. 3. Anterior. Costal part of the diaphragm and anterior abdominal wall. 4. Posterior. T10 and T11, diaphragm, abdominal part of esophagus, aorta, adrenal glands. 5. Inferior. Stomach, superior part of duodenum, right kidney, right colic flexure, right part of transverse colon peritoneal relations. 1. Meso or intraperitoneal. 2. Ligaments connecting the liver to the diaphragm. Ligamentum falciform right pointing arrow separates the left lobe, connects to diaphragm and anterior abdominal wall. Ligamentum hepatogastricum right pointing arrow porta hepatis right pointing arrow lesser curvature of stomach. Ligamentum hepatoduodenale right pointing arrow connects to bile duct. Ligamentum coronarium hepatis right pointing arrow porta hepatis right pointing arrow beginning of duodenum. Ligamentum triangulare dextrum et sinistrum. Ligamentum venosum impressions on the inferior surface. 1. Impressio gastrica right pointing arrow left region. 2. Impressio esophageal right pointing arrow posterior of left lobe. 3. Impressio duodenalis right pointing arrow quadrate lobe near the fossa for gallbladder. 4. Impressio renalis right pointing arrow right lobe. 5. Impressio suprarenalis right pointing arrow left to renal impression. 6. Impressio colica right pointing arrow inferior margin of visceral surface. 7. Impressio cardiaca right pointing arrow superior part of diaphragmatic surface lobes and fissures. 1. Liver is divided into two main lobes, lobus dexter, right lobe. Lobus sinister, left lobe. 2. Divided by ligamentum falciform, fissura ligamenti teretis, fissure of venous ligament, fossa vesicae fillet right pointing arrow forms a wide groove for the gallbladder. 3. Lobus quadratus right pointing arrow between fissures for round ligament, groove for inferior vena cava and portal fissure. 4. Lobus caudatus right pointing arrow between porta hepatis and fissures for venous ligament and inferior vena cava. 5. Processus caudatus right pointing arrow between porta hepatis and sulcus venae cavae. 6. Processus papillaris right pointing arrow reaches portal fissure and fissure of venous ligament sulci, grooves, and porta hepatis. 1. Sulcus sagittalis sinister right pointing arrow contains ligamentum teres hepatis and ligamentum venosum. 2. Sulcus sagittalis dexter right pointing arrow contains sulcus versus cavae and fossa vesicae biliaris. 3. Porta hepatis right pointing arrow deep transverse fissure between right and left sagittal fissures liver segments and blood supply. 1. 5 sectors and 8 segments. 2. Sectors right pointing arrow supplied by second level branches of portal vein and hepatic artery, each has a bile duct. 3. Segments right pointing arrow receive blood from the third level branch of the portal vein and contain a segmental bile duct liver segments distribution. 1. Right lobe right pointing arrow segments I to IV. 2. Left lobe right pointing arrow segments B to 8 vascular supply. 1. Veins. Umbilical vein right pointing arrow inferior vena cava, portal vein. 2. Arteries. Arteria hepatica propria. 3. Triad structure. Ductalis interlobularis, arteria interlobularis hepatica, vena interlobularis.